of respiratory system. We have already discussed about the pharynx and also the development of trachea in the previous class. We'll start with the revision, okay? We all know this is a gut tube. We'll concentrate on the foregut part. On the foregut, in the ventral aspect, we have a small bud-like structure. Okay, this bud is called lung bud or respiratory diverticulum. Okay, from this respiratory. Okay, fine, just look at it now. This is your gut tube. In the foregut region, we have a small bud-like structure which we call it as a lung bud or respiratory diverticulum. From this respiratory diverticulum, your respiratory system is going to develop, okay? This is foregut. This is your lung bud. Okay, and these foldings are called tracheo-esophageal fold, and these folding move towards the midpoint and meet at one point, okay? The point where your tracheo-esophageal folding is meeting will form a structure called tracheo-esophageal septum. And this septum divides or separates your foregut and your respiratory diverticulum. This is foregut. And this is your respiratory diverticulum. Okay, once the separation takes place, this is how your respiratory diverticulum will look, okay? At this part, we call it as laryngotracheal bud. Okay, now we call it as a laryngotracheal tube. Okay, from the cranial most part, we can see the development of larynx. Okay, just above this bifurcation part, we can see the development of trachea. Okay, and from this bifurcation part, we can see the development of your bronchus. Stop talking, bronchus and lung. Okay, and this area of larynx, which is forming a connection or communication between your pharynx part that is called inlet of larynx. Inlet of larynx. Is it clear for everyone? On the foregut part, on the ventral aspect, we have a small bud-like structure that is called lung bud or respiratory diverticulum. From that small respiratory diverticulum, we can see the development of your respiratory system. First, we can see the formation of tracheoesophageal fold, and those fold will move towards the midpoint region, forming a septum called tracheoesophageal septa. This septa divides the respiratory diverticulum from the foregut part. Once the separation takes place, we call it as a laryngotracheal tube or bud. Okay. From the cranial most part, we can see the development of larynx. From the part that is present above the bifurcation, we can see the formation of trachea, and from the bifurcation part, we can see the development of bronchus and lungs. The part which is forming a communication or a connection between your pharynx is called inlet of the larynx. Any doubts in this? This one. This is foregut. This is the same picture. Here we can see only the tracheoesophageal folds on either side, and these folds are moving towards the midpoint. Here I have shown. They are moving towards the midpoint. At one point they will meet each other. Once the meeting takes place, we call it as a tracheoesophageal septa, and that separates your diverticulum from the foregut part. Okay. So the foregut is going to develop as a esophagus and stomach. From the diverticulum, that means from the respiratory diverticulum, these parts are going to develop. Is it clear? Any doubts in this? And all these events are taking place from which week to which week? From 3rd week to 4th week. Okay. Any doubts in this? We have a gut tube. In the foregut region, we have a small bud-like structure appearing on the ventral aspect of the foregut, and that bud is called lung bud or respiratory diverticulum. From this lung bud part, your entire respiratory system is going to develop. Okay. This is the side view of the gut tube, and here I have drawn the front view only with the foregut and the respiratory bud region. Okay. Here we can see the tracheoesophageal fold taking place. Once the folds start taking place, they will start moving towards the midpoint region. Once they meet, we can see the formation of tracheoesophageal septa, and that septa separates your foregut region and your respiratory diverticulum. So now the foregut is going to develop as a esophagus and stomach, and also the duodenum part. Your respiratory diverticulum, once the separation takes place, we call it as a laryngotracheal tube or bud. From this bud, we can see the formation of larynx, trachea, bronchus and lung part. Is it clear for everyone? Any doubts? Okay. Next we will see what is going to happen in the bronchus and lung part. Okay. Okay. Now to see the development of your bronchus and lung part, we have an important event called maturation of lungs. Okay. The very first, there are 4 stages. The very first stage is called, what is the first stage? Pseudogangular stage. That takes place from 4th week to 16th week. This is pseudogangular stage, the very first stage. It takes place from 4th week to 16th week. Okay. Now we will see what is happening in that bud region. This is your trachea. Okay. In this part, we can see the formation of principal bronchi. Okay. And that principal bronchi is again dividing into right principal bronchi and left principal bronchi. Okay. This is the, stop talking, this is the formation of your primary bronchioles. Okay. Once the primary bronchiole takes place, formation of secondary bronchioles can be seen. Okay. We have trachea followed by principal bronchus. From the right principal bronchus, we can see the formation of 1, 2 and 3. 3 secondary bronchi. Okay. And from the left principal bronchus, we can see the formation of 1 and 2. 2 secondary bronchi. Okay. Next, from the secondary bronchi, we can see the formation of tertiary and terminal bronchioles. Okay. From this structure, we have these are the tertiary bronchi. On both right and left side, we have 10 tertiary bronchioles. Okay. First, we have principal bronchi formation. From the principal bronchi, we have right principal bronchi and left principal bronchi. In the secondary bronchi formation, from the right principal bronchi, we can see 3 secondary bronchi, and from the left principal bronchi, we have the formation of 2 principal bronchi, then followed by the tertiary bronchi. On either side, that is on the right and left side, we have 10 tertiary bronchi. Okay. And these tertiary bronchi are surrounded by terminal bronchioles. Okay. The tertiary bronchi are surrounded by the terminal bronchioles. These are the events we see in the very first stage, that is in the pseudoganglia stage. Okay. The next stage is called canicular stage. And this stage takes place from 16th week to 26th week. Okay. The next stage is called canicular stage, and that stage takes place from 16th week to 26th stage. Any doubts in the first stage? First stage, we just have to concentrate on this terminal bronchi. Okay. So, I am just going to draw one terminal bronchi. This is just one terminal bronchi. Okay. To study the canicular stage, we will concentrating only on the terminal bronchi. Can you name the structures? This is going to be your tertiary bronchi, and this is your terminal bronchi. From the terminal bronchi, what structure we see? Alveolar. Okay. In between, any structures are there? We have respiratory bronchioles. Okay. Then followed by alveolar ducts. Then we have alveoli. Is it clear for everyone? We have tertiary bronchi. From the tertiary bronchi, we have the terminal bronchi followed by respiratory bronchi. Then we can see the alveolar ducts. These are the alveolar ducts. Okay. Then we have alveoli. And these alveoli are surrounded by which structure? Alveoli is surrounded by which structure? Capillaries. It is surrounded by capillaries. Is it clear for everyone? So, in the canalicular stage, we can see the formation of respiratory bronchioles followed by alveolar ducts followed by alveoli, which is surrounded by the capillaries. Okay. Any doubts? Any doubts in this? No doubts? In this one, this is tertiary bronchi followed by terminal bronchiole followed by respiratory bronchiole. Then we have alveolar ducts followed by alveoli, and these alveoli are surrounded by capillaries. Okay. So now I will draw only one alveoli picture. Okay. What are the cells we can see in alveoli? What cells we can see in alveoli? Type? Okay. Any other answers? Okay. In this particular stage, we can see the alveoli covered by your cuboidal cells. These are your cuboidal cells. These cuboidal cells are not ideal for gas exchange. Is it clear for everyone? In the canalicular stage that extends from your 16th week to 26th week, we can see the formation of terminal bronchioles, respiratory bronchioles and alveolar ducts, alveoli. In this stage, the alveoli is lined by your cuboidal cells, which are not very ideal for the exchange of gas process. Is it clear for everyone? So, the next stage is called terminal sac. stage, and this stage lasts from 26th week to till birth. Okay. So once the development enters to your terminal sac stage, these are the changes that takes place in the alveoli. Stop talking. Okay. So now we are studying the terminal sac stage. In the terminal sac stage, we can see the increase in the alveoli number. Okay, increase in the number of alveoli. Once the number of alveoli increases, it will increase the respiratory bronchioles also. And this particular stage, we can see the formation of basement membrane. Formation of basement membrane. This is the basement membrane. Okay. Once the basement membrane increases, the number of capillaries will also increase. Any doubts? Any doubts in this? In this particular stage, we can see the increase in the number of alveoli. Once the alveoli increases, the respiratory bronchioles will also increase, and we can see the formation of basement membrane. Once the basement membrane formation takes place, the number of capillaries will also increases. Okay. In this stage, we have only seen the cuboidal cells. Here, the cuboidal cells is going to turn as a type 1 pneumocyte cells and type 2 pneumocyte cells. Okay. Now, this is the type 2 cell and this is the type 1 cells. Your type 1 cells is your flat cells which are ideal for gas exchange, and type 2 is a specialized cuboidal cells which forms surfactant. Is it clear for everyone? In this stage, we can see the formation of type 1 and type 2 cells. Your type 1 cells are flat cells which are ideal for gas exchange, and type 2 cells are specialized cuboidal cells which forms the surfactant. This area is the surfactant now. Any doubts? Any doubts in this? Okay. The next last stage is alveolar stage. This alveolar stage starts from the 36th week and it extends up to 8 years. Until the baby turns 8 years, your alveolar stage is going to extend. The one major change that takes place in the alveolar stage is formation of the septum. Okay. This formation of septa in the alveoli increases the surfactant. More number of surfactant will leads to the more number of alveoli. Is it clear for everyone? Any doubts? This is how the formation of your bronchioles and lungs takes place in the developing embryo. All these happens from third week to, it starts from the third week and extends up to your 8 years. Any doubts? If I say for example during the birth or at the time of birth, there are 10,000 at birth, 10,000 alveoli. By the 8 years it completes, it is going to be the 30,000 alveoli. Those numbers are just an example, okay? That much how the increase in alveoli we can see by the end of the 8th year. Any doubts? Any doubts in the development of respiratory system? Is it clear for everyone? Okay. This is the formation of your principal bronchi and right and left principal bronchi followed by secondary and tertiary bronchials. Okay. Next we have maturation of the lungs. You can see here, we can see in the first set there is only cuboidal epithelium, then we can see the formation of type 1 and type 2 pneumocyte cells. Is it clear for everyone? You can read this, take 2 minutes and read about all the stages. Next we will discuss about the anomalies. First we have anomalies of the larynx. The very first condition is laryngeal atresia and stenosis. This rare anomaly of larynx results from the failure of recanalization of the larynx that leads to the obstruction of the upper respiratory tract. We have already discussed in our previous class how we divide the upper respiratory tract and lower respiratory tract and what are the parts involved in it. Okay. Due to the narrowing in the some sites, most commonly the atresia, that is the blockage, and stenosis, that is narrowing of your pharynx, is seen at the level of the vocal cords. The next condition is laryngeal web. In this anomaly, membranous web-like tissue is present in the laryngeal lumen, usually at the level of the vocal folds, which may partially obstruct the airway. This web-like tissue is derived from endodermal cells that fail to break out during the recanalization of the larynx. Both these conditions are related to the recanalization. Then what is the exact difference? Can anyone say the difference? And both are occurring at the level of vocal cords only or vocal folds. What is the difference? Laryngeal web, laryngeal atresia, both are happening because of the recanalization of your larynx during the process of development, and both are occurring at the level of vocal folds only. So, I am asking what is the exact difference you can see in these two conditions. Here the blockage and also the narrowing of the larynx is taking place, or tube of the larynx taking place. Here you can see the formation of a web-like tissue, okay, in the lumen, that means again in the tube of your pharynx. Next we have respiratory distress syndrome. This, stop talking. This clinical condition affects about 2% of the newborn infants. As the name suggests, infants born with this condition develop rapid and labored breathing shortly. What do you mean by labored breathing? Labored breathing. Labored breathing. Okay, find out what do you mean by labored breathing. Okay. This condition is common in the premature infants. The most common cause for respiratory distress syndrome is the deficiency of the surfactant. In this disease, alveoli of lungs are often filled with a fluid having high protein content which resembles a glassy hyaline membrane. Hence, the RDS is also known as hyaline membrane disease. Okay. Here, this surfactant what I have shown is the surfactant is formed by the lipid and proteins. Okay. The hyaline membrane disease accounts for about 20% of death among the newborn infants. The corticosteroids and thyroxine which are involved in lung maturation and production of surfactant may be used therapeutically. Okay. What is the difference? Okay, surfactant, formation of hyaline membrane. Okay, any other answers? In the second picture, there is a deficiency in the surfactant which is leading to the collapse of the alveoli. Okay, fine. Here the exchange of gas is difficult compared to the normal structure. Okay. Next, agenesis or the non-development of the lung. It is a rare condition and occurs if one of the bronchial buds fail to develop. Agenesis of both the lung is still rare. The unilateral agenesis of the lung is compatible with life. What do you mean by unilateral? Unilateral. Absent on one side or any condition that is happening on only one side of the body. Okay. Can you see the picture and tell me the difference? There is a presence of lung only on the one side and there is absence on the other side. That condition is called agenesis or the non-development of the lung. Okay. Next condition is hypolepsia, hypolesia of the lungs. In this condition, the lungs are usually small and they are underdeveloped. It usually occurs due to the congenital diaphragmatic hernia. Diaphragm is finished, right? What is the reason behind the formation of diaphragmatic hernia? It usually occurs due to the congenital diaphragmatic hernia in which abdominal contents herniate into the thorax region and also to the lung, and it is unable to develop normally because it gets compressed by the abdominal viscera. Okay. Here in the picture you can see both the condition, the normal condition and the condition where your lung is underdeveloped and also smaller in the size. Find out what is the embryological basis for the diaphragmatic hernia and common causes. Any doubts in anomalies? What are the conditions we have learnt in anomalies? In the anomalies of pharynx, we have seen pharyngeal atresia and pharyngeal stenosis followed by pharyngeal web. Okay. Next we have abnormalities of the lungs. One condition is Okay, respiratory distress syndrome, agenesis, and oh, those are the 3 important conditions in the congenital anomalies of the lungs that finish your development of the respiratory system. Okay, thank you.